great to be here as always. I've never been referred to as bedrock before, but I kind of like it. Very good. Okay. We're sort of going to try to expand our horizons a little bit on vitamin C. We've talked a lot about what vitamin C does directly, and it's also good to know what it does indirectly. And we have the fact that vitamin C is really and truly the most important energy molecule in the body. It's basically the fuel on which every cell runs. And we know that mitochondria are the energy powerhouses of the cell. So we're going to try to examine the relationship between it all and show how impacting one aspect of this physiology impacts the other part of it. As with all my presentations, you'll see numbers after assertions and statements, and these numbers you can just go straight to PubMed, type in the number, and get the abstract and sometime the full article, so you can see that if I say something that sounds fantastic, I'm really not pulling it out of thin air. Now, spectacles would help. Truly, the essence of life has to do with electron exchange and electron flow. Electron flow, I'm sure you all know, is also known as current. So just like machines that you plug into the wall run on current, our bodies run on current. They're small currents, but they're currents nevertheless. And it's these electron dynamics that are actually part and parcel of the basic life force, okay? High energy flow, high electron exchange basically equates to health. Compromised electron flow equals disease, and no electron flow equals death. So, it then is important, if this is the case, to look at the different ideas of what produces energy and what disseminates or spreads energy. When biomolecules, and what do I mean by biomolecules? Nucleic acids, proteins, carbohydrates, enzymes, structural molecules, basically any molecule inside your cell and inside your body, even outside your cell, is a biomolecule. So I want to make it clear what I'm talking about when I talk about biomolecules. Now, and this might be one of the most important concepts that I'm going to address right now, is when a biomolecule has its normal contingent of electrons, it's not electron depleted, it's not oxidized, it functions normally. On the other hand, quite simply, when you take one or more electrons away from that biomolecule and oxidize it, that biomolecule either has no function and is a blank key or severely decreased function. So, because of this, disease is not so much caused by oxidation, disease is oxidation. The more biomolecules are oxidized in more locations and more concentrations and a wider array, this is disease. There's really nothing else that determines how sick you are or in what way you're sick than where the biomolecules are that are oxidized. Which then, of course, leads you to the simplistic but wonderful way to approach treating patients, which is twofold. I need to stop the new pro-oxidants, which are also toxins, from coming into the body, and I have to supply as much antioxidants as I can to repair the oxidized biomolecule. And when you get the right antioxidant properly opposed to the oxidized biomolecule and donate electrons, you restore function to that molecule. And if you do it several 100 million times, you restore health to the entire person. So, also very important, all toxins are pro-oxidant or cause a pro-oxidant effect, which means all toxins exert their toxicity by taking electrons away or oxidizing biomolecules. Doesn't matter what the toxin is, and we're talking about, I don't know, at least hundreds of thousands, maybe millions of different molecules out there. These are all toxic by virtue of the fact that they oxidize. Conversely, antioxidants are beneficial because they reduce. They donate electrons, they reverse the oxidation, and in fact, we talk a lot about nutrition and organic food and all these different things, and let me just say that the value of any positive intervention to restore health is directly related to or correlated with the ability of that intervention to produce molecules that have antioxidant capacity at the cellular level. If you don't have electron donating molecules at the cellular level, you've got no benefit from whatever you're doing. Now, these concepts are actually pretty simple in nature, and there's no question that disease is very complex. But it's important to understand this final common denominator. And the biggie there, you'll see in the middle of this slide, is that the biggest, statistically speaking, supplier of pro-oxidants or toxins that take your health down and keep it down are chronic infections, period. Now, yes, you can inhale polluted air, you can drink polluted water, you can eat foods that have a lot of toxins in them, and those are all significant. Those will all contribute to your overall toxin load and the deterioration of your health. But statistically speaking, and I'm not going to have time to get into it in this presentation, I'll tell you that well over 90% of your significant disease processes are caused by and fed by chronic oral cavity infections. Okay? And nobody likes the dentist. Nobody likes how much the dentist costs. Nobody likes how the dentist feels. Nobody likes leaving the office with less teeth than they came in with. But denying this connection is just going to deny you your health and deny you the optimal state of health that you can achieve. Don't kill the messenger. So, and this is what I was alluding to earlier. This slide organizes it a little bit better. When you're talking about the diversity of disease, you say, well, how can so many different diseases be really just one process? And it has to do with which biomolecules are oxidized, where are they located, what is the degree, is it minimally advanced, and how long has it been oxidized? I mean, you have a lot of damage that gets immediately repaired, depending on where the molecules are. You have other damage that's not easily accessed by molecules with antioxidant capacity, and they accumulate. That's how neurologic diseases get worse and worse and worse over time. You get the oxidants in, but you don't get the antioxidants in. So you just lose function, and you never stabilize, and you never regain. Now, to beat this horse down a little bit more, if there's no increased oxidative stress, there is no disease, period. Now, the production of energy. Oxidation, bringing oxygen in and generating energy molecules, ATP. Yeah, this is oxidative stress too. And this is why even in a toxin-free environment, you're not going to live forever regardless, okay? You have an anticipated life duration, a lot longer than most people have it now because of our huge environmental toxin load, but you're designed probably under a optimal non-toxic environment to go 115, 120, 125 years. But I mean, the amount of toxins that we're exposed to is just too much for the body to deal with. But the point being is, even in a toxin-free environment, you will wear down from what's called normal physiological oxidative stress. Now, the ultimate benefit of any antioxidant is to donate an electron, period. End of story. It's really that simple. Why is vitamin C so uniquely perfect for this function? Well, number one, it has a small molecular size. It gets around. Number two, in animals that can make their own vitamin C is derived by a 4-enzyme sequence in the liver from glucose. Glucose, of course, is the natural biological fuel of the body that gets broken down and allows you to produce ATP from a long sequence of events. But the point is glucose has natural transporters in the cells. The SVCT transporters and the GLUT transporters. This is made to order then for vitamin C to utilize these transport mechanisms as well. So it's got a small molecular size. It can use the same and compete with glucose for the same transport sites to get into the cell. And that's where the action is. I mean, vitamin C and antioxidants can be positive effects outside of the cell. Don't get me wrong. Extracellular is important. But intracellular rules. All your significant pathology and whether or not you're going to stabilize it and reverse it has to do with how well you get your therapeutic substances inside the cell, period. Vitamin C, largely because of its similarity to glucose, penetrates all areas of the body, no problem with the blood-brain barrier. And think about this. The average neuron has 100-fold, that's 10,000% more vitamin C inside it than the blood. So that shows you how important neurons are and also how important it is to them to have a continual influx of vitamin C and other electron-bearing antioxidants. Also, I don't know if Ron's going to cover this later or not, but vitamin C, in spite of being a tiny molecule, has double impact. It contributes 2 electrons rather than 1. And finally, even when vitamin C can't directly reduce an oxidized substance, it reduces many other messenger substances that will subsequently do the reduction. So vitamin C, directly or indirectly, will end up allowing you to reduce from the oxidized state, donation of electrons, just about any damaged molecule in the body. I'll skip that one. Now, on to mitochondria. I'm going to try to present to you the information that I've gathered. I definitely do not present or promote myself as some sort of expert in mitochondria. I'm a junior mitochondriologist at best. So, a few facts and figures, factoids, I think we like to say. Mitochondria are present in all cells except the red blood cells. Interestingly enough, mitochondria assume a great amount of mass of your body, so they have roughly 20% of the weight of your body are mitochondria. And also, number 4 is very significant. They have a high turnover rate. So even if you have sick mitochondria with a lot of oxidative stress inside them, if you supply it with the right fuel, they can repair. And a week or two later, if you're doing everything optimal, you can turn things around quickly. So there's no need to suffer with non-genetic mitochondrial diseases any longer than you need to if you follow these parameters I'm going to be talking about. Very simple. The primary role of mitochondria is to produce ATP. And ATP, quite simply, along with vitamin C, supplies electrons. That's what energy is electron supply. Also, mitochondria help produce hemoglobin, lipids, amino acids. They keep the biochemical production process going. And also important is they play a strong role in initiating programmed cell death, apoptosis. Some very interesting physiological features of mitochondria are the membranes. Now, the outer wall of the cell is a bilipid membrane. We have other things, exosomes, liposomes. They're also bilipid layers, and they can merge with the side of the cell by reverse apoptosis, go in. The smaller ones can go through pores. The mitochondria is a double bilipid layer, and I'll show you some pictures in a moment, so that you have two spaces inside there. One, the deep inner part of the mitochondria, the matrix, and the outer layer, the intermembrane space. Also, mitochondria is the only intracellular organelle that has its own DNA. So here's the schematic, and each of the single lines is a bilipid layer. So you can see that separating the matrix from the outside, you have to penetrate 2 bilipid layers, and to just get into the intermembrane space, you just have to penetrate the outer mitochondrial bilipid layer. And this is reflected quite well in electron microscopy. You can see that as well. As I mentioned, a liposome also has a lipid bilayer. And now, just to see how all this syncs and synchronizes together with the natural design of the body's biochemistry, something that I don't think has been talked about enough and needs to start being developed over time is how cells communicate. I mean, we have so many examples clinically of one area of your body getting sick, tumor, whatever, and within a very short period of time, there are manifestations elsewhere in your body. I'm not talking about metastasis. I'm talking about obvious ability of cells to contact and interact with each other. So how do they do that? Well, we have a whole series of substances called extracellular vesicles, and they all have the lipid bilayers, okay? A lipid bilayer is the outside and the inside are water compatible. The middle of it is where the fat compatible parts of the lipids together. So the inside of the membrane is fat soluble, and the inner and outer parts of the membrane are water soluble. The 4 basic types of extracellular vesicles, primarily based on size: exosomes, microvesicles, apoptotic bodies and liposomes. Exosomes were only discovered about 30 years ago. It's very important to understand they're tiny, 40 to 100 nanometers. They can pass back and forth through the pores of the cell quite easily. They don't need to merge with the outer cell layer. As such, an exosome, because all the intracellular organelles, including the mitochondria, have this same lipid bilayer. So once they get into the cell, they can merge with the endoplasmic reticulum, they can merge with the nucleus, they can merge with the mitochondria. In other words, you get a deep cellular penetration of whatever the contents are that's being delivered or held by the exosome. Originally, quite cynically, they were just considered cellular garbage cans as a way of getting rid of stuff from the cell, but we know that's not true anymore. These are secreted by many different cell types, present in sperm, urine, plasma, and bronchial lavage, and known to be strong contributors to supporting normal immune function. These are also used to repair damaged cells. The microvesicles, you can see, are much larger, 100 to 1,000 nanometers. Apoptotic bodies, you know, when a cell starts to kill itself, one of the reasons you form an apoptotic body, which is basically a normal cell that just shrinks down and loses its contents as it, for lack of a better word, dies, gets far too oxidized. But what happens when you rupture a cell, like with necrosis or severe, or like treating a cancer? You immediately release a large amount of toxins, large free iron, other pro-oxidants. So apoptosis is a way to, if you will, kill off cells without acutely releasing a lot of toxicity into the body. Liposomes, it's unclear whether liposomes occur naturally or just artificially, as are produced with different liposome products, but they still have the same basic structure, and they have about a 100 to 500 nanometer size. And because of all the qualities that I told you about, the thing that make liposomes especially potent therapeutic agents for nutraceuticals, and for that matter, even toxic drugs, they've used them for chemotherapy. But to deliver nutraceuticals, you can take them orally and still end up with the payload in the extracellular space, the intracellular space, inside mitochondria, inside nuclei, inside endoplasmic reticulum. Not many other delivery systems can do that. Now, cellular energy production, we've all taken biochemistry. We know that you can get a little bit of ATP generated in the cytoplasm, but the mitochondria, when everything's working right and you're using the electron transport chain correctly, and you don't have a lot of oxidative stress inside the mitochondria slowing and shutting things down, you can produce 36 ATP molecules for every glucose versus 2, okay? Also known as the Krebs Cycle. But I'm not going to presume to teach too much biochemistry because it's kind of out of my domain. I don't want to look intelligent one second and look really stupid the next. Now, interestingly enough, everything in the body that has to do with energy often has to do with gradients, okay? Healthy cells have a transmembrane voltage of a certain level, and when that level starts to drop, functions decrease in ability, things don't work as well, nutrients aren't exchanged as well. So in the electron transport chain, the relay of electrons is also used to pump protons and keep this differential, this transmembrane voltage gradient vital. Now, mitochondria and increased oxidative stress. Very important to understand. Remember I said the mitochondria only live, quote unquote, 5 to 10 days, 5 to 12 days. So there's a pretty brisk turnover, breakdown and regeneration, breakdown and regeneration. We all think about, or what is being talked about a whole lot more these days, is mitochondrial disease. Now, I'm not going to address so much genetic mitochondrial diseases. That's sort of a separate ball of wax, if you will. But just diseases where supposedly the mitochondria aren't functioning as well, aren't producing as much energy as you'd like. Remember, the mitochondria can be no healthier than the cytoplasm. If you have a oxidized cytoplasm, you're going to have an oxidized mitochondria. If you got a healthy cytoplasm, you may have a healthy mitochondria, you might not, but at least the mitochondria has a chance. The mitochondria have no chance of being healthy and optimally functional if you have basic increased intracellular oxidative stress. And once again, this has to do with glutathione, which is the most concentrated of the intracellular antioxidants. Vitamin C, the most concentrated of the extracellular. But make no doubt about it, vitamin C is vital to the intracellular antioxidant capacity by virtue of its ability to continually regenerate oxidized glutathione. So, I like to phrase it this way. I think conceptually the cell and its cytoplasm, along with the subcellular organelles, can be considered as basic support structures for enabling mitochondria and nuclei to optimally perform their functions. And I think that's a good way to approach it. I mentioned the mitochondrial genetic diseases. I'm not going to get so much into that. Interesting thing too about mitochondria, which also shows how important vitamin C plays a role with it, is just like the cell itself has glucose and vitamin C transporters, the mitochondria themselves have vitamin C transporters. The same SVCT2 and the GLUT1 transporters are present in mitochondria and designed to either actively take up reduced vitamin C or passively intake oxidized vitamin C. And most of what we know about it, we just observe. I don't think we still have anything remotely resembling a sophisticated understanding of what I'm talking about here today. But suffice it to say, it has been well demonstrated that vitamin C administration externally increases mitochondrial vitamin C concentrations. So this brings us back again full circle to the concept that I was saying, is that you can't have healthy mitochondria without a healthy cytoplasm. Just not going to work. Okay. Now, I wrote a book called Death by Calcium. And I'm not going to get into that except to say that all sick cells, 100% as far as I know, have increased intracellular calcium levels. You can't have the increased oxidative stress that is seen in all compromised disease cells unless there's increased intracellular calcium. So, what you do with calcium and how you manipulate it inside the cytoplasm has a lot to do with how well you compensate for and adjust to different disease processes. Calcium, for example, in a cell that has increased intracellular calcium can readily be transferred to the mitochondria from the cytoplasm. So The mitochondria can have a buffering effect, if you will, on decreasing the oxidative load inside the cell, but not at the expense of becoming diseased itself. So the only real solution to increase oxidative stress in the cytoplasm that will ultimately be impacted inside the mitochondria is either preventing the calcium from getting in to begin with or finding ways to pull it out. That's what that book addressed. I'm not going to get into how you do all of that, except I will, toward the end of this, show you some of the most important supplements for achieving that goal. So, as I said, right, calcium is a primary regulator of oxidative stress. Interestingly enough, there's a lot of data out there that look at specific toxins, like methylmercury. That's a pretty potent one. And methylmercury toxicity is always associated with the loss of intracellular calcium homeostasis, which means as you get toxicity from methylmercury as a prototypical toxin, not just methylmercury, that toxicity is manifest by increasing the calcium concentrations. And when you get to the point of programmed cell death or frank cell rupture, like with a potent chemotherapy, it's always as the calcium level goes higher and higher and higher. Basically, calcium is one of the most toxic things you can take. Never supplement calcium. I'm going to go into other things that help support the mitochondria in a moment. Important to remember about sepsis. Sepsis, of course, is an overwhelming infection, usually bacterial. We've seen some of the data lately on vitamin C and sepsis in Virginia and the powerful effect that it has. It's important to remember that the thing that sepsis does is it oxidizes, okay? And the more you can block or reverse that oxidation, the better you do. Now, one of the things also about sepsis is that it oxidizes everything, okay? And this is why once you reach a certain set of clinical parameters and laboratory data in your sepsis, you got about another 24 hours to live, and that's it. And one of the things that brings you to that point in time is when the oxidative stress is so high that you've oxidized the cortisol receptors inside the cytoplasm. If cortisol can't bind to its receptors, and what did I say about any biomolecule that's oxidized? It doesn't work. So if you have a cortisol receptor inside the cell that's oxidized, cortisol can't bind it, and you can't get the protective effects of arguably the most important stress hormone in your body, along with vitamin C, incidentally, hydrocortisone and vitamin C. And in sepsis, the more you oxidize it, the more the body tries to make more cortisol to compensate. But of course, it will never compensate if those receptors remain oxidized. So when you give vitamin C to somebody in advanced sepsis, and this has been demonstrated, you immediately reduce those oxidized hydrocortisone receptors, and then the naturally occurring increased cortisol levels that had been trying to compensate for that now can flood the cells, bind all the receptors, and very quickly bring you back to a normal hemodynamic state while the vitamin C mops up the infection. So mitochondrial support agents. Vitamin C, of course. Thiamine, essential for helping to convert pyruvate to acetyl coenzyme A. Pantothenic acid, super important supplement, super underutilized, okay? I would only say that if you take pantothenic acid, it's best to take it in the form of pantethine, P-A-N-T-E-T-H-I-N-E, because regular pantothenic acid is calcium pantothenate. In small amounts of supplemented calcium pantothenate, no big deal, but if you supplement large amounts of it, you're getting too much calcium. Riboflavin, coenzyme Q10, some interesting, odd supplements that I wasn't familiar with, a synthetic derivative of coenzyme Q10 called idebenone. L-carnitine, and this is another one we have that's fortunately can be taken in a liposome encapsulated form. Creatine, D-ribose, NADH, which is literally a molecule that just helps push the electrons down the electron transport chain. All the different varieties of vitamin E, tocopherols and tocotrienols. A very interesting and unusual and prescription medication called dichloroacetate, which is of incredible use in cancer patients, incidentally, and will rapidly normalize or start to normalize the metabolic syndrome-related abnormal blood works, the glucose and the cholesterol and the triglycerides, etc. Alpha-lipoic acid, N-acetylcysteine, omega-3 fatty acids, resveratrol, magnesium, and believe me, just because it's number 17 on the list, I don't mean to low-rate magnesium. I'll tell you in a moment a little bit more about magnesium that's important to know. And even, if I can pronounce it, pyrroloquinolone. Oh, okay. Now, supplements to avoid. I'll get back on my soapbox for a moment. Iron should never be taken, ever, unless you have a documented iron deficiency anemia. Iron is the single most potent pro-oxidant, which means toxin. Remember, toxin equal pro-oxidant equal toxin. Iron is the single most toxic substance you can take on a regular basis, okay? Probably calcium is number 2. Iron, copper, and calcium are all essential for life in small amounts. But they're probably much more significant as being essential for cellular death. You got to remember the body has to be able to, under the right circumstance, kill a cell just as readily as it can nurture a cell. That's the dynamic of life, killing some cells, supporting others. Otherwise, you'd have no features at all. But the important point is all 3 of these are primary agents for increasing oxidative stress. And oxidative stress is the bad guy. Now, basic supplementation. We have what I fondly call the big 4. You know, the vitamin C god might strike me down right now, strike me dead. But magnesium is the most important thing for you to take in large amounts on a regular basis. Why? Because nothing can substitute for magnesium. If you're low on magnesium, nothing else fills the bill. Now, what does magnesium do? Magnesium is a natural calcium channel blocker, so it helps keep from feeding more calcium into the cell and increasing intracellular oxidative stress, which is the primary way that cells get sick and stay sick, okay? And the other things associated with calcium, calcification, magnesium dissolves those calcium deposits. Also, magnesium as a mono supplement, if you were just taking magnesium and nothing else, I don't recommend that. There are lots of things you should take. But as a mono supplement, it decreases all-cause mortality. It decreases your chance of death from everything. Now, how can something decrease your chance of death from everything? Because it positively impacts every cell of your body. Otherwise, it couldn't save you from lupus just as readily as it would save you from heart disease or cancer or stroke or you name it. Vitamin D3, very similar in importance to magnesium because nothing can substitute for it. So I would actually put magnesium and vitamin D3 above vitamin C. Vitamin C, we all pretty much know, at least in this room, what vitamin C does for you. But the only reason it's number 3 rather than number 1 is that other antioxidants, to a limited degree, can compensate for vitamin C deficiency. Okay? Obviously, you want all of these, but I'm just trying to give you a little ranking, if you will. And then vitamin K, K2, which helps mobilize calcium. Think about this. Each one of these, 1, 2, 3, and 4, individually and independently decrease your chances of dying from any disease. So they all positively impact all of your cells. Lysine and proline, that's something that Rath and Pauling put together, and I think the evidence is very strong since cardiovascular disease still remains such a big killer that it's good to include these in a basic regimen that allows you to either keep plaques from building up or help mobilize pre-existing plaques. But remember, or learn, those plaques exist because of oral cavity toxicity. I'll just give you one aside here that's, I think, pretty overwhelming. I'm going to tell you it's very clear-cut, the data to show that over 90%, probably over 95%, and very possibly that ridiculous number 100% of heart attacks are due to oral pathogens. They did a study in which they roto-rooted atherectomy existing coronary atherosclerotic plaques in 34 different people. Then they analyzed them with polymerase chain reaction PCR testing for oral pathogens. They found a multitude of them, bacteria, viruses, fungi, all typical for gum and tooth infections. They found them in 34 out of 34 patients. I'm no mathematician, but I think that comes to 100%. And let me tell you, think about your coronary artery. What business do oral pathogens have being in your coronary artery? Okay? Inflammation of your coronary artery, which my cardiology colleagues now finally acknowledge is the cause of 100% of heart disease. Technically, that's correct. They just don't want to ask what caused the inflammation to start. Inflammation does not start for no reason at all. It only starts because you consume antioxidants. What consumes antioxidants? Pro-oxidants and toxins. So, omega-3, mixed tocopherols, B complex, very important, don't neglect your iodine, potassium iodide. Thyroid function, supported correctly helps everything, ignored hurts everything, okay? If you leave yourself minimally hypothyroid, you will undermine the effectiveness of all I'm saying enormously. Okay. No, you took 5 away from me. Don't give me that. How about this? Okay. So, There's no fixed optimal supplementation protocol. I give you what I consider to be the basic foundational supplements. And I got to tell you, there's a ton of great supplements out there, but there's only so many things you can put in your stomach. And for most people, there's only so much you can afford. So, and everybody has a little bit of a different need, okay? So the goal of vitamin C supplementation is to reach and maintain as close as possible a state of body-wide ascorbate saturation. That's the goal. For the most part, you want to optimize the levels inside the cytoplasm. That's where the action is, at least with regard to disease and most enzymatic function. If your enzymes aren't humming, you're not humming. Now, lastly, might get your 5 minutes anyway. What I call the multi-C protocol, all right? And you have oral liposome encapsulated vitamin C. This is vital because it gives you optimal intracellular access of the vitamin C. And because of the unique characteristics of the liposome, you get the vitamin C inside the cell and inside subcellular organelles, mitochondria, nuclei, without the consumption of energy. So you're getting energy-bearing substance without consuming energy in the process. Just about everything, as we say, robs Peter to pay Paul. Liposomes don't. Much ignored, because it's so simple and so cheap, is regular dosing of sodium ascorbate powder. You could use ascorbic acid too, but it's a little tougher on the stomach, the acid effect. But believe me, long before we had liposomes, long before we used IVC on a regular basis, there were lots of people out there tremendously improving and even curing lots of different diseases when they took 10, 15, 20, 30, 40, 50 grams of sodium ascorbate powder on a regular basis, depending on their bowel tolerance, okay? The gut has immune cells just wrapped around it. So when you take sodium ascorbate powder, you get a lot of intake directly into the monocytes and the other lymphocytes, and you immediately and directly neutralize the impact of a lousy diet and poor digestion because you neutralize the toxins before they get absorbed. And if you take enough, you get that well-known phenomenon that most of us are familiar with called a C flush. And I mean, I did a C flush every day for several years before I finally decided to modify my lifestyle, but it's very good for you. Number 3, ascorbyl palmitate. That's in there because it's a unique fat-soluble form of vitamin C. Now let me say again, everything in the multi-C protocol is certainly not necessary, but you shouldn't give up on vitamin C having the clinical outcome you want it to have on your patient until you've done this. Most of the time, for most patients, you could take any one form of these vitamin Cs, push the dose high enough, regular enough, frequently enough, and you'll get the clinical outcome you're looking for. Of course, intermittent IV administration to optimize extracellular vitamin C, and intramuscular. Dr. Klenner did a lot of work with intramuscular and had profoundly positive results. And there's a number 6. We now have, drum roll please. We now have a supplement that allows you or allows the human being to transcribe galactose oxidase and make their own vitamin C. The only questions remain is what percentage of the population will respond to it? Will it be 50%, 70%, 95%? The preliminary study shows it very positive on 14 out of 14. But I'm not going to say it's 100% just based on 14 people. But taking this supplement doubled vitamin C levels inside the blood. And I've since done anecdotal work to show that when you're on the preparation for a long period of time, your liver makes vitamin C as you need it and allows you to overcome infections that would otherwise put you down for days to weeks. In a nutshell, what happens is there's long been thinking that we just have defects in this last enzyme that just can't be overcome, fixed genetic defects. As it turns out, it's epigenetics, which means stuff that happens after the fact. You have in nature entities called stop codons, 3 nucleotide sequences that bind to the RNA and stop it from being transcribed. They basically abort the transcription process, and you can't make the protein, in this case galactose oxidase, needed to produce the vitamin C from glucose. But it's kind of like gum on a zipper. You go, you're transcribing, and all of a sudden you reach the piece of gum, the stop codon, and you can't go any further. And what has been now pretty, well, deduction says it's been proven. I can't tell you it's been proven, but I can't think of any other way to put together the evidence that we've accumulated, is that we now have agents, certain polyphenols, that allow a phenomenon called read-through. So you come along, you reach the stop codon, and by some biochemical interaction, I can't tell you how, it either goes through, over, around, but then continues to transcribe, and you either end up with a normal enzyme or a near normal enzyme that just has a few defects in it but still has function. So in the future, we're working on a product. Near future, I think we're going to have a situation where we can optimize our immune system by certainly still, this is not intended in any way to supplant or eliminate taking vitamin C, because this just gives you a good baseline. We're going to talk about what's called regular infusion of vitamin C in low amounts around the clock. Well, this is an internal form of doing that. This is what you call vitamin C 24/7, all right? So, and there's also evidence, and it's beyond my scope here, of other polyphenols already that have effectively cured other genetic diseases, namely resveratrol and beta thalassemia. Beta thalassemia is a genetic disease where you don't produce enough hemoglobin and you have to continue to take transfusions your entire life. And it's been shown quite conclusively that taking enough resveratrol in over 50% of these patients eliminates their need for transfusion. So a lot of exciting stuff in the future, and we'll chat a little bit again tomorrow. Thank you.